When we talk about community care scholarship and the community care sector, we're really referring to what happens in organizations that are helping our Singaporeans out of the hospital. I think public healthcare in general is one that is growing. It's one that if you feel you have the passion and in terms of wanting to also grow professionally and what you can contribute, this is the sector. In the community is where we really need to go now. If you want to make a difference, what we say, not just on the ground, because in the hospital it's also on the ground, but in the community care, we are actually with them every single day, right? So if you talk about following someone on the journey in their life, making a difference, that's where community care is, and the need is growing.
Let me share with you what I've been up to in my past 4 years in SIT. Lessons is not very traditional, like having a lecturer in front of you and then the students taking notes. We have a lot of peer learning where we will have to do some self-preparation before, and then we are also very big on applied learning where we bring what we learn in class to a very simulated setting, so you can see us in our uniforms in a ward. Lastly, placements. I think this is one of the highlights in my 4 years in SIT, so I actually got to try out different sectors. It's really like the one assignment that you have to really consolidate everything that you've learned in school and bring it to a real life setting, and it also gave a teaser of what to expect in the future.
Community care sector is something which you might want to look at. We are all very client focused. So meaning that we don't work on our goals, we go based on their goal. We also work with other allied health professionals, like doctors, nurses, where we work together as a team. So we actually have to communicate with them, see where the patient is progressing on. Then we actually move on, help to plan out the next few weeks, how to help the patient to discharge towards home. Also, I think community care sector, the job itself is rewarding. You will see them getting better, you will feel sense of accomplishment, sense of fulfillment that they are getting better because of what you have done to them. Community care sector also have very good personal and professional growth. There are always professional development programs, like courses you can take to help you develop those skills better in a more professional way.
If we can't say that we are proud of Singapore as a place to live in and age well in, we cannot truly say that Singapore is a place that we are proud of. So our vision actually in AIC is to build a Singapore that we truly can say is one of the best places around the world to age in.